All right, we're live. My name is Dr. Byrd. I'm a psychiatrist here at Coleman Regional. I was going to talk to you today about isolation, depression, and also the mental ramifications that come along with it. So to start off with, I want to say that the fact that you're watching this video alone is a step in the right direction. And may suggest that you are curious or maybe having some issues like this of your own. So we'll start with mental health and how to kind of look at mental health. We don't have to look at mental illness alone. We can also look at mental wellness. How well are things going? And at no point should you feel that having a symptom should have a stigma associated with it. Everyone's having a very hard time right now, and you are not alone in that situation. So if you can be willing to address the issues that you're having, you can help others with theirs as well. All right. The other thing is, as far as seeing a psychiatrist, seeing a therapist, talking with your friends, talking with your family, it's very important that you utilize any and all avenues that you have available to you. So we'll start with what to do during COVID. And initially, we talk about social distancing, but the primary word there being distancing, and the primary word should be more socializing. So looking at it as distant socializing. One of the most important things that we can do is learn to use video chat. There's Zoom, there's FaceTime, there's many applications that utilize some form of being able to see the person you're talking with and also to hear them, much like a video phone call. If you don't know how to use this, please go on YouTube and learn how to use this. Your family will love it. And it's also a way that you can keep in touch with your family even better than you have before when you could go and see them. There's really no better time to learn than right now when you have so many people have lots of free time on their hands, and it will be a valuable skill when COVID is gone. The other thing is to call and check in on others. It's very important to realize that you are not alone in this, but also the friends, the families, coworkers, everyone that you're can imagine, a significant proportion of those people are also having very similar issues of isolation, feeling depressed, not being sure exactly what's going on, what's going to happen, when is this going to be over. So the stress is not a unique thing, although it is something we frequently don't talk about. So one thing that you can do is to offer support to others and just check in. How are you doing? Not only is that helpful to other people, but it also allows you to have a sense of control and that you are helping in a meaningful way and have some sense of purpose. Another thing that you can do is to take time to formulate things that you would not otherwise say to people, as far as how much you appreciate other people, how much you care about family members, how much other people mean to you. Many times in life, we don't take the time to say these things, but when you ask people in their dying days, what are the things that they wish they had done more, it would be more genuine and vulnerable with those people that are close to you. So this is an excellent time to intentionally strengthen some of those relationships. Another thing to do is to reconnect with old friends. Facebook makes it very simple to find old friends, to find out what they're doing now, to catch up with them, see how life has been treating them. Maybe another opportunity to reach out and offer some emotional support to them as well. How are they handling this? Speaking with those old friends, it's going to be very important that you are open and honest about your own situation. Each person believes that they are the only one who is dealing with these feelings of confusion and anxiety, also feeling depressed and not really having anything to get up for in the morning. So again, it is not unique, and it's very likely that if they're saying they're fine, that they may also not be doing fine. And so you can be the one to encourage them to open up by opening up yourself and simply stating what your experience has been like. Another very easy thing to do is to simply turn off the TV. The majority of the news that we have is emotionally draining. It is intentionally shocking. It is mostly negative. And we have a tendency towards a negativity bias with the news. Insofar as if we can get someone's attention, we can keep them hooked onto the news program. And what ends up happening is you're watching the same cycle over and over, which allows you to view the world in a more negative way than it objectively is. I'm not encouraging you not to be informed, but be very mindful and considerate about how much news that you're taking in, and also, is it emotionally charged? Could you use a print option instead of a video option? Could you scroll past the dramatic headlines for things that matter to you? The other thing about the TV and news primarily is just how time-consuming it is. We have always used TV too much to pass free time. However, during COVID, it's only gotten much worse. We've noticed that since COVID started in about mid-March, that the viewing time has increased by about 8 hours weekly on average. Also, when you look at what part of that TV, what part of that screen time is being accounted by what material, 64% is the news. So we are watching not only more TV, but also more stress-inducing content. So the time that we're wasting with the TV has amplified, and we're also watching more and more emotionally draining content. So be mindful of where you're getting your information and be willing to know when is enough. The other thing that we're seeing is days that are blurring together. People have the idea that the weekends and the weekdays are all the same. And the subjective feeling of that is matched by what we see in the data, that people are watching television later and later and later into the night and watching less more early in the morning. So this is a good proxy to figure out what our sleep schedules have been. We're finding now that Monday viewing is greater than it is on Saturdays, which is something that's very unusual and I think reflects how atypical the time is right now and how people's normal routines have been uprooted. And that goes very well along with that narrative of kind of being confused and not knowing exactly what's going on. So apart from the news, if I turn the TV off, what is it that I should be doing? The answers are simple. They may not be most straightforward, but they are simple. It may be difficult to get yourself to pull away from the TV, but that is what I would encourage. Go outside, get some vitamin D, take a walk. Simply being in nature has a slower pace, and so that allows us to slow down with it. People routinely notice less stress, less feelings of anxiety, less feelings of depression, and feel a sense of rejuvenation once they're in nature. And being in nature doesn't mean going to a state park. It can be simply walking around your house, anywhere outside where you can see the sun. The other thing about going outside is nature has a way of taking care of itself and reminding us that we don't always have to be doing something. Sometimes we can simply be. And this is where we call ourselves human beings and not necessarily human doings. And it's a good reminder that that the world will keep spinning even if we let off of our guard and our tasks that we find to be so important. When you are going to go outside, you may as well get the benefit of exercise as well. Exercise has been shown to reduce inflammation, to reduce anxiety, to reduce depression, to increase sleep, and also improve cognition and memory. Most people will ask the question of, if I'm already exhausted, how can you expect me to go outside and exercise? And exercise tends to have a paradoxical effect in that you seem to be more energized when you're exercising. It improves blood flow and also kind of allows you to feel that you're doing something in a concrete way. When we're sitting behind a desk all day and we're not really seeing any effects of our labor, it can be very helpful to break away from that and just simply move around. And the improvements on cognition and memory, anything that's good for the heart is good for the brain. And so as we increase that blood flow, we increase the blood flow to the brain. That's going to help stave off things like Alzheimer's disease and also improve memory as well. And again, you can always combine the two. So taking a walk outside, we aim for moderate exercise. Moderate exercise is what we consider when you're winded to the point that you could not sing a song, but you could talk if you needed to. The other idea about gauging that would be sweating. You need to feel that you're warm and you may be perspiring a little bit, but you don't have to be sweating through your clothes. And so a lot of times people assume that exercise is this overly strenuous activity that if I can't do something very extreme, then I'm just not going to do anything. And that's one of the most insidious ways that we can get down into being unhealthy, being overweight. So simply getting outside, going for a brief walk, and trying to do something that you enjoy. If that's playing games with your children, if that's taking your dog for a walk, or if it's simply walking off some steam of being frustrated. Get outside and move in some way that you find enjoyable. The other thing would be simply reaching out for help if you need. The things that we've talked about so far are ways in which we can help ourselves to try to take control of our lives, try to structure our lives, and try to allow us to feel that we do still have some control. Sometimes that is not sufficient. We do know that mental illness is very common, even more common than the statistics suggest, primarily due to stigma. The statistics alone suggest that 1 in 5 Americans will have a mental illness in any given year, but even that is reliant on people telling you what they're experiencing, which we know is a very difficult thing to do. And that's each and every year before COVID. Since COVID, the symptoms of depression and isolation have increased to somewhere around 60% for the general population. And again, these numbers are inherently conservative in that this is a field that we typically don't address. So many people with mental disorders don't seek treatment, and also so many people that don't necessarily have mental disorders but are simply not doing well don't seek help. So sharing with a friend, sharing with a counselor, sharing with a psychiatrist, getting treatment, getting medications if needed. It's never too early to have an assessment. And if any time you feel that you may be heading down a direction that is spiraling towards feeling out of control, feeling anxious, feeling suicidal, any of those times, hopefully intervening before it gets to that point. But at some point, we desperately recommend that you reach out for help and know that you're not alone. We want our patients to live satisfying, fulfilled lives. And the best way to do that is to first acknowledge truly where you are. And right now we're in a situation where we don't have subjective control over our situation. We don't have great answers to COVID. But what we do have is control over our own actions and also we have very many things that we can do to take control of our situation, but that's going to mean taking a few steps up front, setting a bedtime, even though you don't necessarily have a reason to get up in the morning. Give yourself something to do that's meaningful. Reach out, talk to other people, and try to set those boundaries where you can still have some sort of purpose in the mornings. If these things fail, we are always here. We have counselors. I personally work we opened a clinic, Turning Point Health Center. The contact information is right here. You do not have to have a mental illness diagnosis to call us. We would recommend that you come in sooner than later, and so that we can help address these things early. No question is dumb, and we really want to help you help other people as well. Another kind of resource that we have is the NAMI Health Line is 800-950-NAMI, and that's 6264. And any other counselors that you have in your area, I strongly recommend reaching out for help if you feel that you need that. Do we have any questions? Okay. No questions so far. I'm also, I'd like to introduce physician's assistant that works with me, Mary King. Have her step up here as well.
Hello, it's very nice to meet you here today. Both Dr. Byrd and I are accepting patients at this time, and you can make an appointment at any time to see us. Thank you so much for your time.
All right, so that'll close now. Please reach out if you need any help, and remember to take care of yourself